Intimacy in cancer is one of the very difficult conversations to have. It's a difficult conversation to have with your partner. It's a difficult conversation to have with your treating team because it's intimacy. People don't want to talk about it. Has that been something that you found? Is that a difficult thing to discuss with your patients?
It's a huge problem, not only for the patients, but for their caregivers as well. Let's say, for an example, husband and wife, where the wife might be undergoing treatment and maybe experiencing nausea, maybe feeling a lot of pain, might not be feeling like a sexual being at all, but the husband's completely healthy, and vice versa, of course. So these are massive issues that come up.
We speak about intimacy. Are we talking about intimacy specifically as sexuality, or is intimacy a variety of different pillars?
Intimacy can mean so much for different people. It's that feeling of comfort that you can bring one another, that feeling of closeness. Those moments of intimacy are almost sacred, in fact, and very much needed by every human being on the planet.
So intimacy just isn't necessarily a conversation between partners. Intimacy is a conversation in any relationship. It's obviously a very different type of intimacy, but sitting and sharing a coffee with your mother or your father, it could be a conversation, it could be sitting on a mat playing with your child, and the way that you approach that aspect of your relationship, even through the very difficult times of cancer treatment.
It's definitely something that both people involved need to be comfortable with. So what my expectations of intimacy might not necessarily be yours. And so again, that old word communication, the importance of being able to find that space that you are comfortable to discuss this. Remembering again that intimacy does not necessarily mean sex. So intimacy, those moments where you get really close and you have such a beautiful conversation that makes you both feel so fantastic afterwards. Or I'm sitting down watching TV and my loved one is playing with my hair. And my loved one might be my child. My loved one might be my partner, might be my sister. Those are intimate moments. And all of us need a degree or a level of intimacy in our lives because it makes us feel appreciated. It makes us feel loved. It makes us feel great. Have a bickie. Let's dive into that conversation a little bit more deeply.
So intimacy is obviously a very difficult conversation. How do you initiate that conversation with a loved one? I mean, as you had mentioned, intimacy is not just the sexuality of a relationship. Intimacy is what I would imagine would equate to many people's different love languages. Some people may be physical affection, acts of kindness, buying gifts. You know, there are many different ways of talking about it. How do you initiate the conversation with a caregiver or with a loved one?
It's going to vary from every person. And you actually mentioned it. Everybody's got their own love language, their own way of expressing things. So what might work for me might not work for you. So you have to explore different options that feel safe, that feel right for you at a moment in time that is right to have that particular conversation. And it might not be a conversation with words. It might just be a conversation with acts. So taking that hand and giving it a little massage and getting feedback, is that working or is that not working? Or stroking hair or massaging a scalp. Perhaps that's part of the communication, not necessarily conversation.
So it's not necessarily about opening up a specific channel or conversation and speaking openly right at the beginning of the process and saying, what do you want? What do you not want? How can I be there to support you? How can I walk through the journey? Not just as the caregiver or the loved one to the person that's going through their cancer treatment, but also that individual going towards their loved one as well, because intimacy is definitely a two-way street.
I think for those people that are able to talk, to have that frank conversation with one another, they'll be able to, right, let's have this chat, you know? Yeah. But that's not where everybody is. And that can be excruciatingly uncomfortable. So again, what works for you? I think trying to be bold to explore that. You've obviously identified as the patient or the loved one that this is an issue, this is a concern, this is something I'd like to explore with you in a little bit more detail. But if you are too uncomfortable to use the words to broach that topic, try with actions. But it is important enough not to be ignored.
It's obviously very important for both parties in the relationship to do it. We've often spoken about it, and that would be life goes on. Cancer is cancer, but life goes on and you need to continue living. And so this isn't necessarily just advice towards the caregivers trying to be intimate or trying to engage with the person who's going through the cancer journey, but certainly that person engaging backwards as well, because we have to continue working on our relationships.
I think that important message that life goes on, that you are more than your cancer. You cannot be defined by your cancer, and life goes on. And certainly your loved ones around you, life goes on, most definitely. And they are not experiencing that level of physical discomfort and emotional discomfort that you might be as a person diagnosed with cancer or being treated for cancer. And so many people that are living with cancer have intimacy problems, have sexuality problems, because let's talk about physical changes. Perhaps there are physical changes on your body. A breast might be missing, a leg might be missing, a testicle might be missing. And so those are a scar, lost hair, all of these sorts of issues might change the way you view your own body, the way you feel about yourself. It might even affect and influence your loved ones and how they respond to you. They might suddenly be a little bit more distant because they're frightened of hurting you, or they're frightened of doing harm. And so it really is an important issue that I think everyone is aware of, but is too frightened to bring up or broach or discuss. And hence the conversation today is just opening up that conversation over a cup of coffee and trying to just present options that might help.
Okay, so let's talk about the physical nature of intimacy for a moment. You've brought it up. How do I speak to my spouse about something that is that difficult, where he or she might not be feeling the way towards me that they used to, or vice versa, and I don't know how to broach that topic with her? How would I broach that topic? What would be your suggestion over a cup of coffee, sit down calmly? What's my opening line? I know that that's a very difficult question, but what would be your recommendation for how to engage that?
Let's talk about intimacy.
Subtle, to the point, not so subtle, yeah.
But again, that's how I might broach it, but that might not be possible for everybody. So again, just maybe actions as well. So, for example, making a cup of coffee and creating a relaxed situation, perhaps lighting a candle, drawing a bubble bath. There are lots of different options that you can pursue, that you don't have to actually use the words, which might be difficult for you to say. Look, if you are able to have that conversation out, just to say, this is something that I'm worried about. This is something I've read about. This is something I've watched on a YouTube clip. Is this something that you've thought about? Is this something that we could maybe discuss? And maybe it's a little embarrassing. I'm a little bit shy, but it's important. I really have this belief that you cannot allow cancer to take more than what it will. Do not allow cancer to take your relationships. And over the years, I've seen this happen where marriages are split apart because of a cancer diagnosis, and that is too high a price to pay. Not just marriages, but relationships between children, between parents. That is too high a price to pay. So if this topic is important, then it needs to be discussed. And in as relaxed an atmosphere or an environment as what you can possibly create, try and bring up the topic to find out how your other loved one is feeling. And I'm thinking in my mind about a loved one in terms of a spouse, but of course that can be any partner. It'll be a different conversation if it's with your child, obviously. It would be a different conversation if it was with your parent. But even parents require intimacy, and children, as we know, certainly require intimacy. That feeling of loved, of being safe, of being cared for, of being nurtured. And I think it's pretty safe to say that all of us need that.
Okay, so to have an incredibly difficult question thrown at you, we don't want to let it take our relationship. We don't want our relationship to devolve into something that's not there anymore because of this big pillar. You know, cancer is a difficult thing in its own right. We don't need that to then not become the difficulty that we're fighting. Now we're fighting the difficulty of our relationship, or, you know, whatever that happens to.
And that just compounds everything.
Yes, yeah. So now I've got 4 different battles that I'm trying to work my way through, as opposed to cancer's cancer, let's let that be the fight and let's sort out everything else that is. So like at what point do you just
You can't
close your eyes and do it,
Yeah,
as crass as that sounds?
As soon as you start forcing it, it becomes even more unnatural in a already relatively unnatural situation. The fact that you've got cancer and you're trying to fight for your life on that.
Sure.
So there most definitely is a huge space to approach professionals, to go, and again, if you're comfortable with speaking to your doctor or your healthcare provider, but there's specialists as well that deal with intimacy issues, and to go to them as a couple, as a team, and just say, this is important enough to us that we've recognized that this is another area that we need to work on. This is another area that needs healing.
Sure.
So because it's important enough to us, we're going to take that step to find that healing that we need.
So irrelevant of what aspect of cancer it is that you're dealing with as an individual, whether it be a caregiver or someone who's living with it themselves, paying very special attention to the relationships around you and what's influencing them and making sure that you're staying on top of it is incredibly important. I mean, having a solid support structure is, I would imagine, a large portion of your fight to come or the fight that you're in.
Wow, you hear this word of support all the time. And it seems to me that people living with cancer, those that do the best, and that, when I say doing the best, that doesn't necessarily mean ending up being cancer-free. But through that journey, those that manage the best, that are able to go through that journey in a positive way almost,
So continue living.
are those that have great support structures and systems that are in place.
You don't put a pause button on your life because you have cancer.
No.
Irrelevant of what the ultimate outcome may be, you carry on living through it. You keep progressing.
You cannot let cancer take your life before your normal life course is done.
Sure. The intimacy that we're talking about has obviously got different connotations based on the relationship that you're dealing with at that specific moment. What are some of the tips and tricks that you've learned through your time about how to engage or how to improve the intimacy in a relationship of those different ones? What are some of the tips that you've dealt with before?
It's a conversation over time. It's an awareness that here is an issue. Let's work on that issue together. So it's about being vulnerable and allowing yourself to be vulnerable in possibly a situation you're a little uncomfortable with. Having that honest conversation at the level that is appropriate for the person that you're interacting with. And being kind. Remembering to be kind to yourself and cut yourself a little slack. You're going through a lot as a cancer patient. You're trying to survive so many issues at that moment in your life. And you've identified here is another issue. Approach it with gentleness, with honesty, with rawness and vulnerability sometimes.
I think one of the important things as well is to be aware of what the other person is communicating when you talk about love and intimacy. Certainly one of the conversations that I often have with people is I can be screaming a message to you in the language that I'm speaking, but if you don't speak my language, you're not going to be hearing whatever it is I'm shouting. So that be true for communication and for love and intimacy. If my love language is physical affection, whereas yours is words of affirmation, it doesn't matter how much I play with your hair to tell you that I love you. You're not hearing that because you're waiting for me to say it, because that's what you hear. And I think it's very important to be cognizant of not just the way that you communicate your love and your affection and your intimacy, but what the other person on the opposite end of that relationship is hearing and how they communicate it. More often than not, it's not necessarily that you're not telling the person that you love them. You might be screaming it at the top of your lungs, whether it be through actions or whatever. But if that's not what they hear, then they're not going to be hearing what you're saying. And I think there's a very, very often a big breakdown in relationships just because of that factor, not because there's no love.
A critical point of all of this communication is that it's a two-way conversation. And that it's not just me saying, well, this is what my needs are, these are my words, this is my language. This is about a two-way communication.
Yeah.
between two people and sometimes a family and intimacy within a family. So often you've got family members, perhaps, and even sometimes friends and communities that are so busy trying to protect the one that's got cancer, you're almost wrapped up in a cotton wool ball to keep safe, and no one really wants to engage in deep, meaningful conversations with you or bring up topics that might cause you more stress. And again, it's that gentleness and that kindness and that honesty and that vulnerability to be able to say, it's okay, this is important, let's talk.
The focus of the relationship becomes the person that's having the fight with cancer. But that doesn't stop me from still feeling things. But I don't want to add to your load, so I don't talk about my problems because, well, me feeling what I'm feeling is nowhere near as important as what you're feeling because you're having to struggle with cancer and I'm healthy, and how dare I bring up something that is my concern? That must be a very difficult sort of hurdle to cross when we're talking about this.
I suspect that this is true. My health, as the person that is diagnosed with cancer, that is the person that's living with cancer at the moment, my health is so integral with the support structures around me. And so working on the health of those relationships, the health and the support of that family is part of that whole support mechanism that I ultimately need along my journey. And it works the other way as well. The family's terrified. They're looking at this person that they absolutely adore, that they love, who is really going through the hardest time of their lives at the moment. And they also need that reassurance that life goes on. We're still having these conversations. We're being honest with each other. We're talking. We're communicating. We're doing this together. It's not just that person on their own. We're doing this as a team.
How important would it be then to find alternate support throughout that group? So whether it be a small family, a larger community, or whatever the case may be, if you're really going through a difficult time and you're unable to engage with me on this topic, would it then be a good idea to go and engage with a different person that is in that group? Being able to have the conversation with someone else who may be experiencing something similar in terms of a lack of intimacy from the person within that group, just to say, this is what I'm struggling with, so that I'm not, maybe I won't feel like I'm burdening you as the person who's dealing with the health issues. I can now unload onto someone else and we can walk through it together, you know, multiple people helping each other or holding each other up. Is that maybe a good option?
I think if I can understand what you're saying, you're talking about almost an intermediary. So I want to give you an example. If I struggle to talk to my partner about an intimacy issue, but I feel quite comfortable having a similar conversation with my sister to say, you know, I'm really struggling with an intimacy issue with my partner, and I'm chatting to my sister because that's a safe space. That's a person that has heard all my stories in the past and kind of knows me. Even that intimate moment of sharing with my sister helps. Now, ideally, of course, if your sister is able to speak to your partner and be the intermediary for you, that would be great. But I think when issues escalate to a problem where it really is a problem in terms of this is causing a life issue for us, that's when you really need professional help. Thanks for tuning in and watching our video. If you have any questions, comments, or even suggestions on what you'd like to see in future content, please leave them in the comment section below, and we'll get back to you as soon as we can. We're here to support you in your journey to learn more about cancer and how to manage it. Join our community and empower yourself with knowledge and resources to make informed decisions about your health.